Thank you, Mr. Chairman. On page 21, line 5, we would like to add the following amendment. It is the policy of the Democratic Party that we will put people before profits by fighting for a Medicare for all single-payer health care system to guarantee health care as a right, not as a privilege, to everyone in this country. Working together, we will end the greed of health insurance companies. That's the motion.
Is there a second to Mr. Zogby's?
Second.
There is a second. Now, would you like to explain that?
I would like to explain it. We heard quite compelling testimony during our session that dealt with this issue. In particular from nurses who told stories of patients who could not receive adequate care because they lacked insurance. One nurse in particular told of her personal story of how even though she is insured, because she has a son with autism, she could not get treatment for herself. The cap on what her insurance would cover was exceeded by that, and so she herself was doing without health care. That is unacceptable in our country, and I believe that what this amendment calls for is an aspirational goal to which we must, or toward which we must work, and that is that health care is a right and that we place it above profit. It is not a business. It is the business of America should be caring for our people and making sure they all have health care. It's been a goal of our party since FDR, and in successive administrations we've tried. We passed the Affordable Health Care Act under President Obama and a Democratic Congress, and I will tell you, I wept the day it passed. I have a daughter who has a granddaughter. I have a granddaughter as a daughter of my daughter who has Down syndrome and leukemia. The thought that she would forever be able to get health insurance because even though she had a pre-existing condition, she could not be denied, was very significant. And when the Supreme Court affirmed it, I wept again. It is important that it passed, and no doubt there's progress there. More people now have health insurance than ever before. Kids under 26 can continue to get coverage by staying with their parents. And we do have advances that have been made, but we're not far enough along the way. If people in Canada, the UK, Germany, France, Scandinavia, Holland, Japan, etc., if they can have health care as a right, we can in the United States as well. When we pass a Medicare for all plan, every American will have the freedom to go to a doctor when they need it without worrying about premiums, deductibles, or fighting with insurance companies. To me, it's unimaginable that we've gotten to where we are today. That when my daughter would get the bills from the hospitals, that they'd be in the $60,000, $70,000, $80,000 range for just a few days treatment. Thank God the companies were covering it, but what if you don't have coverage, as many people don't? And how much money is being made by the companies and the hospitals in this system that has gone completely out of control. Parents shouldn't have to worry about how to take care of their kids. People who are under 50 should have the same assurance of coverage that folks over 50 can have because of Medicare and Medicaid. The fact is that we need to consider this. Now, there's a lot of arguments that we've heard on our side and on your side about why this may not be able to be done and why we ought to stay with what we've got and continue to tinker. What we're proposing is an aspirational goal, where we ought to be, where we want to be, the target that we ought to be shooting for. It is Medicare for all, it's insurance, it's putting people before profits, and it's making sure that all of our people receive the coverage that they deserve because there are people.
With unanimous consent, I'm going to make this a 5-minute. I'm going to make this a 5-minute, Andy. 5 minutes. You have a minute and a half for the pro. Mr. Ellison. I'm sorry. No, you got. I said you got a minute and a half.
No, I'm asking this. We need to second his motion.
Oh.
Oh,
You got one,
sorry.
yeah.
Sorry about that.
Ms.
You know,
Lee. Oh, are you?
No. What I wanted to just say very quickly, look, one of the proudest moments of my life is when I got to vote for the Affordable Care Act. It was great. It was awesome. I'm so proud of it. But here's the thing. It is based on a private insurance system. It's based on that system. And many of us fought hard for a public option. That didn't prevail. And I think that, the reality we live in today is there's a 6.5% inflation projected for 2017 in medical inflation. We don't see the double-digit inflation we saw in the past, but we do not see the declines that we should. And this is because we're still tethered to this private insurance system, which I think creates a real problem. And personally, I think this is a laudable goal for us because at the end of the day, if medical inflation just keeps going up, it's going to strengthen the hand of those people who want to attack ACA. I think if we're not moving forward, then we're going to be moving back. And every time because we don't have a public option, a single payer goal, we are subject to whatever the private sector wants to do. So with that, I'll vote yes, and I urge other people to do the same.
Anybody in opposition? Anybody in opposition? Ms. Tandon? Opposition now has 5 minutes, and then I can go to you, Ms. Lee, because you come under the party.
So first of all, I don't really want to couch my comments in opposition because everyone in this room, every single person in this room has fought for healthcare as a right. We all fundamentally believe healthcare is a right. We all believe that we should put people before profits. I will offer an amendment as well. And I really want to acknowledge what Congressman Ellison said, which is that the Affordable Care Act was an accomplishment, but I also want to acknowledge that the question before us is not just the Affordable Care Act or some other goal. The questions before us are how to accomplish the task of ensuring everyone has health care. For example, we have language on a public option. There are steps we can take to build on the Affordable Care Act to meet the goal of ensuring health care for every American. And there has been important steps on costs, on savings and costs, but there are other steps we can take, which is what the language in the platform has today. But I want to say that I would like to offer language acknowledging that Democrats all agree that health care is a right and that it's not a privilege, that it is something that every American should have, every person should have. I completely agree that this has been a right that we have fought for, presidents have fought for year in and year out. And it is a true accomplishment. And I acknowledge the voices that we heard from who are concerned about the current system. But I do have to add the voices that I know we all care about, voices of people who are alive today because of the Affordable Care Act. But I say that recognizing that I assume most people in this room support the Affordable Care Act. It was a proud accomplishment. And my view of this is that we should not accept the status quo, that we should, all of us, work together to actually pass a public option, ensure there's an option of people to buy into Medicare, steps we can take to improve upon the Affordable Care Act, to reach our shared goal of universal health care and health care as a right for every person in the country. And so I speak against this amendment, but I really share the goal of ensuring that we do cover every person and that they have the assurance of health insurance that works for them whenever and wherever they need it.
Anyone else in opposition? Anyone rebuttal? Yeah, Ms. Lee, I'm sorry. Ms. Lee,
Thank you very much.
you opposed?
No,
I'm just curious.
I'm in support.
All right.
I'm in support. First of all, let me just say I agree with what has been said by both sides tonight. I did help negotiate the ACA, and I'm very proud of what it has accomplished. I wanted to make sure that whatever amendments came forward did not affect or exclude those who were covered under ACA. And this amendment, I think, is a good amendment. It builds upon the ACA. We've got to do more. And you know, my late mother told me, where there's a will, there's a way. And so I think this is very clear here. I think it states very clearly, not necessarily how to get there, but it is aspirational where we want to go. And I would just ask that instead of saying in the greed of the health insurance companies, say of the big health insurance companies, if that's okay with you, Mr.
Is that a
Zucker.
friendly amendment?
That's a friendly amendment.
I accept.
Just the big health insurance
I
companies.
accept the friendly amendment.
Okay, thank you very much. I think this is a good amendment, and we got to do this. It's a matter of life and death for so many people, and we've got to go further. So thank you very much.
Anyone else? Anyone else? All right.
Is rebuttal time?
I thought we did.
No.
Yes, Slugby.
Yes,
I'm sorry.
I'm looking at the amendment you're going to propose, and it reminds me a lot of the same way that we approached the environmental issues, which is we agree, it's important, it's got to be done, but any effort on our part as Democrats to define a way forward, i.e. Medicare for all in this instance, or a single-payer plan, we won't talk about. And so I urge you to consider voting for this, because I believe that it is not only an expression of where we want to go, but a way forward to get there. And I therefore rest my case.
Can I just, can I respond, or do I do that in my amendment?
You can respond. Go
Is there
ahead.
rebuttal to the rebuttal?
I'm going to give her just 30 seconds.
I would just urge you to look at the language within the platform and consider the steps within the platform that also try to reach our goals. And I appreciate that we might have different manners by which we get there, but I hope you recognize that many of us have been working on this together. I have worked with members of Congress on the ACA and other steps, and that we have steps here in the platform to not just accept the status quo, but move beyond it to get to health care for every American that is affordable, reliable, and something everyone can be secure in.
Ladies and gentlemen, time has expired. Time to vote. All those in favor of the motion, please raise your hands. All those opposed? 7-6. 7 against, 6-4. Next.